So in this question, we say the psychiatric nurse is suddenly met with a neighborhood in a local grocery store. The neighborhood say to the nurse, "How is Carol doing? She is my best friend and is seen at your clinic every week. What are the appropriate nursing response?" So confidentiality, also the privacy, both is important, right? It is not important what question we are getting to get here, but always we have to provide the patient confidentiality. Very important. So now there are the four options which is important. Whatever they are my friend or neighborhood, you do not share any information who is not related to the patient. So there are four options. One, I cannot discuss my client situation with you. I am not supposed to discuss this, but because you are my neighborhood, no, never ever, right? It is illegal. Number three, you may want to know about the Carol, so you need to ask her yourself so you can get the story. So whatever they do, it is their choice. But my option, which is the best response, I am not supposed to discuss this, but you are my neighborhood, no? So when we deal with that medical condition like this, keep in mind, we always follow the ethics of principle. We protect the confidentiality of the patient health, right? In also the patient health care information. So I cannot discuss any client situation to others. Hmm? So we chose number one. So what is the rationale here? The nurse is required to maintain confidentiality regarding the client and their care. Confidentiality is a basic of the therapeutic relationship, but it is also the part of the Health Insurance Portability and Accountability Act. As a healthcare provider, protect the confidentiality of a patient healthcare information, but confidentiality also the part of therapeutic communication, they said. So we do not share anything to the others. A client with delirium because becomes agitated and confused at the night. So it is a cognitive disorder and patient is confused. What are the best initial intervention by the nurse in which action? So move the client next to the nurse station. It is good choice, but not initiation, initial intervention. Use a night light and turn off the TV or television. My patient is agitated. My patient is confused. My patient has a cognitive disorder like delirium. So we always provide them quiet environment. right? So if you off the television, it can make the noise. So turn off television is a good choice. Also use a night light, right? It helps. Keep the television on and soft light during the night. So we do not choose number 3 because they say keep on the television. Number 4, play soft music. No, because my patient is confused, hesitated. So number 2 is the best option because of the TV, quiet environment, and also use a night light. So what are the rationale they said? It is important to provide a consistent daily routine and also low stimulation environmental when the client is agitated and confused. Noise level, including a radio or television, may add to the confusion and disorientation. And moving the client next to the nurse station is not the initial intervention. So let me talk about two keywords. It's called delirium and dementia. Both are cognitive disorder, but delirium is a acute and reversible. And delirium actually the disturbed of the mind that occur in some medical condition like fever, intoxication, or other disorder, and it is characterized by restlessness, or sometimes patient is illusion or incoherence of thoughts and speech, but it is acute and reversible. Whereas the dementia, it is a chronic and irreversible condition. And that affect the language or memory, cognitive behavior, or personality, even judgment. And these are irreversible. Dementia is more common in Alzheimer's disease or Parkinson disease. In this question, we can see our patient is the delirium. What next? Question here, the nurse is collecting data on a client who is actively hallucination. Patient have hallucination and this is active. So we see the hallucination is one of the perceptual alteration, maybe auditory or visual or tactile, right? Is a false sensory perception without any stimulus. And my patient has a active hallucination. So what are the therapeutic way to communicate with the patient in the psychiatry department? Number 1, I know you feel they are out to get you, but it is not true. So when patient says something and if you stop them, it is the blockage. And at least the way you talk, they thought you are sincere about their complaint. So we approach a therapeutic way, not approach non-therapeutic way. So non-therapeutic way, we should avoid it. Like here, I know you feel, and last, but it is not true. So it means you reject them, right? So ignore the client response. Number two, I can hear the voice and she wants you to come to the dinner. So it is absolutely lying, right? So we do not tell anything lie to the patient. So again I said, we do not say, we do not ignore, or also we do not lie to the patient. Number three, sometimes people hear things and voice or things or voice others cannot hear. So this is the broad, open. You do not tell something or lie, or you do not ignore them. Mhm. And also it means you give them significance, and the same time you reinforce them, re-educate about the problem. It means you assume understanding, right? So number three is a good choice. It is therapeutic way of communication. I talk to the voice you are hearing, and it is also lying because you know it is hallucination, and you will not talk to the voice, right? So what is their explanation? So it is important of the nurse to reinforce reality with the client, right? So they said number one, two, and four do not reinforce reality, but reinforce the hallucination that our voice are real. So then you can give them time to verbalize their feelings, keep silent, and you can evaluate what actually they want to say, right? So in psychiatry, we need to know three terminology: delusion, illusion, and hallucination. Let me explain. So delusion, illusion, hallucination. So delusion means a false fixed belief, and illusion means misperception of stimulus, and hallucination is a sensory perception, but there is no stimuli. So here I said delusion, illusion, or hallucination both are positive behavior symptom of schizophrenia. What next? So the nurse is caring for a client with diagnosis the depression, right? The nurse monitored the sign of constipation and urinary retention, also known that this problem are likely causes by which condition. So our patient is have diagnosed the depression, right? So usually the depressive patient, we can see all of the sign are negative, like this: be sad, they feeling empty or no pleasure about life. They like they crying, not eating, body weight loss, and they feel fatigue. And also their mood switching, memory loss. So in that condition, we give them antipsychotic medication, right? Or antidepressive medication. But when you give the medication and this question related the problem may be related to the medication because they said monitoring the sign of constipation and urinary retention, poor dietary choice. So known this problem likely causes by what? What condition? Lack of exercise, poor diet, inadequate dietary intake, and dehydration, psychomotor retardation, and side effect of medication. So, uh, which one? The question here, when you answer the question, you have to read the examiner mind. In what medical condition they are asking this question to you. I know the poor dietary choice, it is one of the cause. Even if you do not choose the fiber containing diet, it leads to constipation. Lack of exercise, poor diet, chance of constipation, but not urinary retention. Inadequate intake and dehydration. They can inadequate intake dietary intake and dehydration can cause constipation, but dehydration do not cause urinary retention, right? Number four, psychomotor retardation and side effect of medication. So your patient is depressive, you're supposed to give them antidepressive medication. So antidepressive medication has a common side effect. They can cause the constipation, they can cause the urinary retention as well. So how we have to remember? Let me answer it first. Rationale. In this situation, urinary retention is the most likely causes the medication. So in this urinary retention is most likely causes the by medication. Option 4 is only option addressed both constipation and urinary retention. Constipation can be related to inadequate fluid intake, lack of exercise. What else? The retention, urinary retention is nothing related to 1, 2, 3, 4. 1, 2, 3, right? So the medication we use for the depression, we call antidepressive medication like TCA or other medical antipsychotic. Even we use the SSRI. So I said that another medication also we use for the anxiety called anxiolytics. More common is the benzodiazepine. So antidepressive medication or anti-anxiolytic medication like diazepam or flurazepam, alprazolam, lorazepam, all of them has a common side effect. Easy way to remember: A, B, C, D, and S. A stand for altered the vital sign. Vital signs means blood pressure, heart rate, and pulse rate. So if your patient take antidepressive or anti-anxiolytics or lorazepam, alprazolam, flurazepam or diazepam, their blood pressure go down, heart rate go down, patient develop hypotension, patient develop bradycardia, bradypnea. B stand for blur of vision, bradycardia. C stand for constipation and confusion. So if your patient have a confusion, we tell them to take fiber containing food and enough intake of fluid. Patient develop confusion. So safety is more important. Prevent the fall. In this clinical scenario, our patient is a depressive, and also the medication if you give, patient develop the confusion. In that case, safety or prevention the fall is the most priorities. And D stand for dry mouth, or D stand for distension of urinary bladder. A common question NCLEX would ask, if patient have a um, dry mouth, what we could do? Give them candy, right? Also, sedation. S stand for sedation. S stand for stasis of urine or urinary retention. This is the common side effect of benzodiazepine or antipsychotic medication. Yeah. Also, it is important to know all of the antipsychotic medication has a highly addictive to the patient. So it is good to tell your patient, do not take the same medication for a long time.